Welcome back to In Focus. It's time for our Africa Health Network update. Health reporter Linord Moudou joins us now with some news on an event recently held in West Africa to help combat breast cancer. Hello, Linord.
Hello, Vincent. Hello, everyone. Well, the second international Susan G. Komen Ghana Race for the Cure was recently held in Kumasi. The event focused on raising awareness about breast cancer and encourage women to get screened for the disease. Here's part one of my two-part series recapping the event. It is early morning in Kumasi, and thousands of people have gathered outside the Babayara Sports Stadium. They are here for the second annual Susan G. Komen Ghana Race for the Cure with the theme, Get Involved, Together We Race for the Cure. Created in the United States by the Susan G. Komen Foundation, the event is one of the world's largest to raise awareness and support for breast cancer. The race was introduced in Ghana last year by Breast Care International, a non-profit organization dedicated to the establishment of breast cancer awareness centers throughout the country. Dr. Beatrice Adai, the founder of Breast Care International, says it was timely to bring the race to her country.
Breast cancer is killing a lot of women in Africa, and so Breast Care International saw it as timely to get involved with Susan G. Komen for the Cure, to come and help us organize such a race in Ghana on the African continent. It's a global fight, and we want to be a part of it to help save our women from dying this untimely death. Where a woman lives should not determine whether she should survive breast cancer or die, and that is why we are doing this, to show that we are in Africa, we are in Ghana, and we want to also survive breast cancer.
Ghana is the third African nation to organize the race after Egypt and Tanzania. The country ranks 10th in the burden of the disease in Africa. Dr. Adai says one of the main challenges is lack of awareness.
Ignorance and lack of awareness is killing a lot of women, even more than the disease itself. They are not coming to the hospital because once there's no pain, they feel there's no danger. With this kind of awareness creation exercise, a lot of women are going to know that the disease is real. It's not caused by witchcraft. It's not a curse on a family, especially those with positive family history, and that other women have survived it. So it's a survivable disease.
More than 20,000 men and women of all ages participated in the 5-kilometer walk. Some were local Kumasi residents, others arrived from the capital city Accra and many other parts of Ghana. The international race was also attended by participants from Israel, Yemen, and the United States. Dr. Sharon Kapambwe heads the Cervical Cancer and Training Program for the Center for Infectious Disease Research in Zambia, CIDZR. She hopes to learn from the Ghana model.
Since we have a base of cervical cancer screening program where we have screened over 80,000 women in the last 5 years, we can use that as a foundation to add breast cancer screening to it. And this will, because there are already structures that are built for that, and this will help to make sure that breast cancer comes as a priority as well.
A race participant and a medical equipment professional both spoke about why they are involved in the event.
I'm here because in my country, Ivory Coast, breast cancer is ignored by many women. Many do not know that getting diagnosed early increases their chances of survival. So I will go back to my country and encourage women to get examined.
My name is Vincent. I come from Paris in France. And I think there's a lot to bring in this country, but first of all, it needs to start with initiatives like this to bring awareness, to bring screening, and then to bring the care to patients.
Reverend Tammy Denise came from the U.S. state of California. She is a breast cancer survivor, and she says she sees some similarities between African American women and the women in Africa.
A lot of things such as lack of awareness, lack of education, lack of access to care, family in the African American community in the U.S. Quite often you will find the woman as the sole breadwinner or the top breadwinner for the family. Same thing with African women. They may not be the breadwinner, but they are the nucleus that keeps the family together on a day-to-day basis. So if they are out having treatment or ill and unable to perform their daily duties for the household, then that family suffers.
There are other survivors from the United States here as well. Tiffany Jones is executive director of the organization Pink Chose Me.
I was diagnosed in 2005, aggressive breast cancer, and at the time I had no health insurance. And talk about something scary, wanting to get something foreign out of your body and can't. And through that journey, I just wanted to create something that women can come to, that you can talk to and learn about breast cancer. I had no idea what breast cancer was when I was first diagnosed. So now with the education and what I'm doing with the non-for-profit, I'm spreading awareness through my story and also through the journeys and the other stories of women that I found.